Hi everyone, welcome back in today's video. So in this tutorial we shall be discussing how to use the malaria rapid diagnosis test. So in this video we shall be discussing how to use the malaria rapid diagnosis test. So before you start the procedure, first introduce yourself to the patient. You explain the importance of doing that procedure to the patient. You gain consent for you to continue the procedure. So what you do, you gather or you get your malaria kit. So each bag contains an alcohol swab. So each pack contains an alcohol swab. So we shall be using the alcohol swab to clean the hand before we do the finger prick. Okay, there is also malaria buffer solution. So this is the malaria buffer solution. Okay, we also have the lancet. So we shall be using the lancet to prick the finger. Okay, we also have the blood dropper. So we shall be using the blood dropper for dropping the blood. Okay, we also have the malaria antigen test. So this is the malaria antigen test. Okay, let us proceed now. So what do you do? First, you clean the finger. You clean the finger with an alcohol swab. You clean the finger with an alcohol swab first. So you clean the finger with an alcohol swab. You dry it with a cotton wool. So you get the lancet for pricking the finger. So you get your lancet for pricking the finger. So you get your lancet. So you do a finger prick first. You do a finger prick first. You do a finger prick. So you do a finger prick first. Then you wipe off the first drop of blood first. You wipe off the first drop of blood. Then you squeeze the hand. You squeeze the hand gently like this. So you squeeze the hand gently like this until you see. So you squeeze the hand until you see a drop of blood. A drop of blood. Then what you do? You get your blood dropper. So you get your blood dropper. You get your blood dropper. So you get the blood dropper. So you get your blood dropper. Then what you do? You get your malaria antigen test. So you open the malaria antigen test. You open the malaria antigen test. Then what you do? You drop the symbol of blood into the buffer, into the buffer window. So this is what you do. You pour the blood there. Then you add 2 drops of buffer in the buffer window. So you add 2 drops of buffer into the buffer window. You add 2 drops. You add 2 drops of buffer into the buffer window. Then what you do? You wait your result until 15 minutes or 20 minutes. Don't read the result before 20 minutes. So you have to read it after 20 minutes. Okay, or you can wait until 15 minutes around there. So now, so if you see 2 control line, that will be a positive result, and if you see 1 control line, that will be a negative result. So we shall wait our result now until 15 minutes. So you read the result after 15 minutes, as you can see in the result below. So we only have 1 control line. So if we have only 1 control line testing, so this is negative. So this is a negative. But if you observe, if you see 2 control line, that will be a positive result. That will be a positive result. But if you see your control line around this area, so it will be invalid result. So there are 3 types of results. We have the positive result, we have the negative result, and we have the invalid result. So invalid result can happen if you do the procedure wrongly, or if the malaria antigen test has expired. So you will see the control line test in this side. But if you have two control line in the other side, so that will be positive. If you have one control line test, that will be negative. So this is how we are going to use the malaria rapid diagnosis test. Thanks for your watching. Have a nice day.